Hi there, and thank you for joining us at the one thing you need to know if you've just been diagnosed with COPD. Actually, I'm going to give you more than just one thing, several things. So your doctor has diagnosed you with COPD, and you're probably asking yourself, now what? So I'm going to give you some very specific steps that you can take to keep your breathing easier. I'm Kelly Welton. I'm also known as the breathing specialist, and I'm so glad that you found me. I've been a registered respiratory therapist for 32 years, helping people just like you. And I realized a while back that although helping 10 or 20 people a day at the hospital breathe better and learn to cope with their breathing difficulties, I should be touching a lot more than 10 or 20 people a day. And because I care about my breathing family, I made this short video just for you. Now, this video is not intended to treat, diagnose, or cure any disease. We're just here to help you. But if you landed here, you need some answers. So first of all, what exactly is COPD? And I'll answer that in a second. But the first thing I want to warn you about is don't go searching all over the internet. There's many sites out there with outdated or just plain wrong information. So be sure to only use a trusted source, such as the NIH, which is the National Institutes of Health, at www.nih.gov. There's a ton of trustworthy information there. Or you can come to my site, copdsuccess.com. And when you go to copdsuccess.com, you can go to the blog, and there's all kinds of free information on there. And I update it regularly. So what is COPD? COPD stands for chronic obstructive pulmonary disease. And in a nutshell, it means you can get the air in, but you have a hard time getting it out. And the result is feeling like you can't breathe at all because you don't exhale all the carbon dioxide, which is a waste product, and make room for clean, new, oxygen-rich air. Now, before I go on, I want to stress a very, very important point. If you feel like you absolutely cannot catch your breath or you can't breathe, I want you to call 911 or call your county's or your country's emergency services. Don't try and wait it out. Definitely, if you feel like you cannot catch your breath, you want to call emergency services. Now, I know I said I would tell you the one thing you need to know, but I'm going to give you several more important points. Here's number one. At the first whiff of a cold or flu, anything that feels like a cold, go and get seen. Do not delay. You, unfortunately, have a chronic illness, and with that, a tiny virus or cold or flu can very quickly turn into big trouble. Now, the second thing is go for your testing. Your doctor should have ordered some lung function tests, either something called spirometry or a full pulmonary function study. Your doctor may have also ordered a walking test. Both of these tests are very important for us to know how to best treat your breathing difficulties. Your doctor may have ordered some blood work. Again, these results help us determine what will help you the most in the long run. So COPD is a term that covers asthma, emphysema, chronic bronchitis, and other diseases. It's kind of an umbrella term for anything that, as I described earlier, you can get the air in, but you have a hard time exhaling all the air out, and the resultant feeling of fullness makes you feel like you just cannot breathe at all. And spirometry, very important test where you blow into a tube. A walking test, they'll have you walk around the halls wearing something called a pulse oximeter to measure your blood oxygen levels. And finally, a blood test, so we can measure the amount of carbon dioxide in your blood, amongst other things, to see how we can help you the best. Finally, your doctor may have prescribed some inhalers for you, so please make sure you know how to use them correctly. In what order should you take them? What technique should you use? Do you need a spacer so that they work the best? Have somebody show you, your doctor, your nurse. If they have a respiratory therapist in the office, even better. And here's my last quick tip. Ask your doctor about pulmonary rehabilitation. It may not sound like very much fun, but it'll be the best thing you can do for yourself. Pulmonary rehab has been proven to increase the quality of life because the truth is, exercise is the one thing that will help you feel better. I know it's difficult because when you exercise, you get out of breath, and when you get out of breath, you don't want to exercise. And what pulmonary rehab will do for you is break that cycle. Now, if there's no pulmonary rehab program available near you, consider copdsuccess.com. It's a very similar online education and exercise program. Now here's the one tip that's the foundation of my program to relieve your breathlessness. So if you feel short of breath, and you may be doing this yourself naturally anyway, but you want to take a breath in through your nose and you want to blow out through pursed lips as if you're whistling or blowing out candles on a birthday cake. So practice this move often. In through your nose, pursed lips, blow it out. What that does is kind of stent the airways open and help you get rid of all that stale air that's in there. So practice that often. If you're still smoking, please do your very best to quit. There's a lot of smoke enders resources out there. If you go onto YouTube and you can search for COPD Success Arsenal to Quit Smoking, there's a ton of resources on there that will help you quit. If you've already quit or you don't smoke, yay, congratulations. Education about your disease and how to help yourself is the foundation of the COPD Success program. To learn more breathing tips, exercise tips, nutrition guidelines, and a whole lot more, visit us today at copdsuccess.com. If you elect to join the program, there's 24 short, easy to understand topics of learning. There's a workbook to help you track your successes. Thank you for joining. I hope this has been helpful for you, and I really hope to see you on COPD Success. Bye for now.